So imagine a situation where a person is fallen on the floor or in the road, and suddenly you have to go and help them out. So first what we need to do is make sure that you as well as the patient are in a safe environment. So make sure that you shift the patient to a safe place. Once you've shifted the patient there, make sure you tap them on the shoulder very hard and shout, "Sir, are you okay? Sir, are you okay?" Once you've recognized that the patient is unresponsive, immediately shout for help and activate the EMS services. You can activate the EMS services by even using your mobile phone and calling for an ambulance. Once you've established that the patient is unresponsive, you have to check for the pulse and breathing simultaneously. Check for the pulse in the carotid artery and check for more than 5 seconds and not more than 10 seconds. While if there is no pulse, immediately start your CPR. CPR should be given at the center of the chest between both the nipples, and using your palm of your dominant hand, interlocking it with your other arm, you have to place it at the center of the chest, making sure that your elbow, wrist and shoulder are aligned in a straight line. And the compression rate is 30:2 with a depth of compression around 5 to 6 centimeters, and we need to give them at a speed of 100 to 120 per minute. Make sure that you allow adequate chest recoiling, as this is very important. This basically makes the blood come back into the heart, into the ventricles. So again, when you're compressing, the blood is into the circulation. Make sure that you minimize all interruptions so that the chest compressions which you give is going to be benefited for the patient. So as you can see over here, make sure that I have to again re-emphasize to make sure that you have a chest compression of around 5 to 6 centimeters, and make sure that there is adequate recoiling so that, as you can see over there, the blood is filled again. Once you've given your 30 compressions, then we move on to your airway. In airway, before delivering the breath, we have to make sure that we open up the airway. The opening up the airway can be done by either doing a head tilt chin lift, or in trauma patients we can do a jaw thrust. So head tilt chin lift is basically what it does is it makes your airway, your oral, laryngeal and tracheal airway go into one straight line. So when you deliver the breath, it directly goes into the lung and does not go into the stomach, which may even cause aspiration. So once you've opened up the airway, make sure that you pinch the nose and form a tight seal around the mouth and deliver a breath of lasting of 1 second and no less. So in a case where there are single rescuers and 2 rescuers, the person who is doing single rescuer has to take care of both the chest compression as well as the airway. But when there are 2 rescuers, one rescuer can take care of the airway while the other takes care of the chest compression. The ratio of 30:2 for chest compression does not change at all. Make sure that you continue the 30:2 ratio for 5 times, which should approximately take 2 minutes. After which only should you check for the pulse. If there is no pulse after that, immediately resume your CPR. You have to continue resuscitation until either the victim shows signs of life, which we call as return of spontaneous circulation, where there is a pulse, or qualified help arrives and takes over, or if you become tired. So this is the latest BLS for suspected COVID or confirmed COVID patients. So what they have latest identified is, make sure that we don appropriate PPE before entering the place where we need to give our resuscitation, and make sure that you limit the personnel to maximum of 2 or 3 and the required people are only there. And the other thing is, instead of doing a mouth-to-mouth resuscitation in out-hospital cardiac arrest, make sure that if there is a bag mal, you can use that, or only giving CPR is more than enough, and that is what is recommended by the 2020 guidelines.